Hi, I'm Sarah Key, coming to you from Salford University. I just want to quickly run through what the 5 stages of breakdown are, which comprise stages 1 and 2 of my masterclasses. First of all, we have a stiff spinal segment. I believe this is what we feel all the time with our hands, yet there's nothing wrong on the scans. The intervertebral disc between the vertebrae is completely normal, completely thick and healthy, but the patient's complaining of pain, and we can feel that segment won't go and is very sore. I believe that's 90% of the cases of low back pain and entirely remediable through therapeutic means, both mobilisation and through spinal decompression techniques. That's stage 1, 90% of cases of low back pain. Stage 2 is facet arthropathy, when if you don't have enough suck and squirt of your lumbar segments because you've had a small injury of that outer disc wall, which is the tensile part, then the disc will start to thin. When it thins, it means that your facet joints at the back override, and facet joints aren't meant to be load-bearing at all because they're movement controllers. Second most common form of low back pain, I believe, facet arthropathy. Third stage of my 5 stages of breakdown is acute locked back, when that lack of water in the disc equates to lack of pressure, and also we know that there is delay, often of multifidus, that you can be unlucky enough too if you don't prepare for a movement properly, where you can come slightly, if you like, unstuck at one of the facets at the back, whether it's entrapment of little fat pads or whether it's a meniscoid inclusion. It's still a coordination control problem, predisposed to by that lack of pressure in the disc and the poor coordinated control from all the different muscle controllers, tummy and spinal. And then we have stage 4, which is a prolapsed intervertebral disc, extremely rare, often diagnosed, less today than it was, caused by load transfer from the nucleus to the annulus. As the nucleus dehydrates and shrinks, that breaks up the disc wall, makes it easier for the nucleus, which is changed in structure, to be able to squeeze out progressively through layers in that wall. And then the final stage is the unstable segment, with the sort of gradual rendering of incompetence of the disc itself and the 2 facet joints at the back. The segment itself becomes much harder to control, especially when the patient goes to bend forward. Now, all of these spinal stages, you are taken through what the signs and symptoms are and the way to treat them. The way to palpate with your hands, whether it's centrally or the facet joints, and what you can show the patient to do themselves using the BackBlock. Now, the BackBlock is a very important part of self-treatment with the Sarah Key method, as of course is using the foot to mobilise the spine. Again, a big part of spinal treatment with the Sarah Key method.